The oblique lateral interbody fusion is a procedure that was actually developed in Melbourne, Florida, also called the OLIF. Dr. Hines, myself, and Dr. Wassell came up with the concept of a minimal invasive approach to access the anterior spine through the oblique or lateral portion of the abdominal cavity, coming in behind the abdominal cavity, but in front of the psoas muscle that attaches to the spine. There's a very unique plane and window that we can access to apply a good sized spacer across a collapsed disc space or a damaged disc to help achieve a fusion. The advantage of the OLIF is we're able to put a large cage all the way across the disc space, which will allow for more stability and better fusion rate, and it can all be done in a less invasive manner, usually for a one-level surgery with a 1-inch incision, using a tube system to dock down onto the spine and perform the surgery through the tube system. These surgeries can be done either outpatient or overnight stay, and the recovery time is very fast for the patient. Particular standalone operations don't even require an incision on the backside of the spine. Also, we use this technique to reconstruct the spine. Patients who've developed scoliosis, collapsed disc, spondylolisthesis, and other conditions where the spine becomes unstable, it can be utilized as a correction tool to straighten the spine, realign the spine, and achieve a fusion. In the old days, it would require a fairly significant operation to take down the entire side of the abdominal musculature just to get that kind of exposure. Now we can access several levels of the spine through 2 or 3 1-inch incisions, all using the tube system. I'll show you an example of what the spacers look like and what the tube system looks like that we use. This is an example of a spine model. This shows an access at the L5-S1 level with a spacer put into the damaged disc and a plate and screws to hold it. And this is all done with the patient lying on their side, and we come in and do our work this way. And this shows an example of the tubes that we would use. Through a small incision, we'll actually come and dock down onto the spine and do all our work through that tube system in both those areas. So the advantage is we're able to do a good structural operation on the spine with very minimal risk or damage to the patient's tissues or structures.